Hi, everyone. So good to have you here with us. As always, thanks for joining us. I'm Dr. Margo Jacquot. I am your mental health business mentor, here to help you figure out what you need to do to provide great care to people and have a lot of business agility, because boy, don't we need it. And our guest today is just that. I was just here kind of feeling we're dressed in the same colors. We're both entrepreneurs. We're both therapists. We're like, this is a rare breed. So delighted today to have our guest, Marta Hamilton. Marta is the founder of TeleWellness Hub, a digital platform startup revolutionizing the experience of access to mental health and wellness providers. TeleWellness Hub instantly connects users for free to mental health and wellness providers and their full range of content, offering on-demand access and flexible options for provider appointments and their services beyond therapy, educational videos, podcasts, provider-created products, and resources all in one powerful digital hub. With a background as both a licensed mental health counselor and entrepreneur, yay, who successfully launched a private and later group practice, yay, my twin, she's passionate about breaking down barriers to care and helping providers grow their impact without burnout. Yay, you, and welcome, Marta Hamilton. Thank you for being here with us today.
Thank you. I'm so excited to join and get to talk to you and be on this side because I've been doing some podcast hosting, and it's always refreshing to get to connect with other people as a guest. So
Right?
thank you.
It is.
Yeah.
I think it sort of refines my way of thinking about what I'm doing for my podcast, for my business. I always love that, and I just had the pleasure of being on a new podcast with a couple of colleagues in the area, and it was a lot of fun. So anyway, so Marta, I have to tell you, I've got this entrepreneurial wild hair, which I think for some therapists, they just don't get. Like, what is that thing? And I'm assuming you have had it as well. But tell us a bit about TeleWellness Hub and just what you're doing these days.
Okay. Well, TeleWellness Hub was came to mind during the pandemic. I think a lot of that time brought a lot of pivoting. And for me, that pivoting involved me trying to find new ways to expand the impact of my group practice. So at the time, we had yoga instructors, coaches, neuropsychologists, counselors, and I thought, how do we change our marketing, our digital marketing approach to reach people in other parts of the state to share that we do more than one-on-one therapy sessions, that we have group sessions, that we have testing, that we have consultation. And I couldn't find a directory or any other platform or all-encompassing agency that was affordable or could easily really showcase everything that we were doing. And I say we because I think at the time in my group practice, I loved all the counselors that was there. I thought of that were there. I thought of them as mentors. Although they were, independent contractors, I think there's power in really thinking each other as colleagues. And before we hit record, I heard you talk about what everyone contributes to really help the practice thrive. And I thought, gosh, what could we do from a visibility standpoint to really help us move forward and help all of us thrive and this practice thrive? And I just couldn't find anything that like really encompassed the ability to showcase all that we do, all that we are, and really reach a broad audience. And so I spoke with a family member who works for a global like tech marketing industry. And I said, hey, I think you should create this kind of directory for the modern wellness provider. And they were like, that's a lot of work. I have a full-time job. Why don't you do it? I was like, okay.
And all your spare time
And
running your
so,
practice and seeing your clients and everything
yes.
else, right? We have a ton of that.
Yeah. But, I thought, I'm going to try this. That is kind of maybe that entrepreneurial spirit where I think I'm going to investigate. I'm going to talk to people. I'm going to see what can be done here. And I'm going to keep going until the doors are clearly closed. Like, no. And the doors kept opening and the doors kept opening and the doors kept opening. So just kind of knock on those doors. And so now I'm at the point where I saw my last therapy client in December of 2024. So it was slowly phasing. Thank
Congratulations.
you. The therapists that were in the group practice are now independently in their own private practice. So I feel like they were able to transition, and I'm doing TeleWellness Hub full time, which we launched a beta version of this I call it a directory, but it's much more than that, just to kind of gather data, see how it was going. And we onboarded over 700 providers. And I realized, yeah, like there's a
Wow.
need for us to be on a directory, because really that's like the core of it, the foundation, where we can list all the states that we are licensed in, all of the titles, because I'm an LPC, I'm a supervisor, but I'm also a certified coach, and I also do consulting. Like, how do I access the client that's looking for me?
There you
And
go.
yeah, and I've seen in your podcast, the last episode, working with an art therapist who has published. I knew colleagues who were doing workshops, who have done TED Talks, who publish books and workbooks and digital downloads and podcasts. And I thought, why doesn't something exist where the client can tap into this? And so that's what TeleWellness Hub is. And I'm so excited because I now have a dream team, really, of web and tech, product development, and branding. And we're releasing a completely custom web app this month. So this is perfect timing to get on here. It's like, yes, we're going to have our open house and it's going to be just better than ever. So I'm very excited. I'm very
Mm,
excited.
Congratulations,
Thank
Marta. I
you.
mean, perfect timing. I love to be here with you as you're
Yes.
doing that.
Thank you.
So this is what you're doing full time now. You're not seeing therapy clients. You don't have your group practice. You really pivoted. I mean, we could have a whole conversation
Oh,
just
yeah.
about pivoting, but I want to come back to the idea that you said the doors kept opening,
Hmm.
right? And you didn't know that you could do this,
I didn't know.
and you tried.
I tripped.
Right. You tried. And then
Oh,
you
yeah.
kept trying, and
Yeah.
the doors kept opening. Had you just said, I don't know how to do that. I'm not a tech person, none of this would have happened. And it sounds like a great platform for all of us.
That's the goal. I really wanna, like, I feel like the time is now for us to come together. I mean, I'm not a venture capitalist funded platform, right? I don't have all the bells and whistles of that, and it's been slower and steady, but there have been great, the doors kept opening, but I mean, I tripped on my way. I, like, knocked, and sometimes it didn't open, right? But along the way, I have met incredible people, and I think therapists have that amazing power of connecting with others and having an innate curiosity, right? Like, we ask like questions, we're curious, we're reflecting. And I think that helps us as therapists also be entrepreneurs, because it was about researching, okay, well, what does it look like to start this? What venture mentors can I find? What programs exist out there that can help guide me, that can do market research, that can let me know what I need to do? Um, so yeah, that's
So exciting. So exciting, Marta. And to your point, and folks, something like this, I can see if you have a venture capitalist backing you, and they're all over our space right now, right? I mean, welcome if you'll play nicely and will support us and do well and do right by our people. Great. But you chose not to do that because I bet you could have gotten investors. What made you decide not to? Because that's another roadblock of,
it's a
I
huge
don't know how to do
roadblock.
this and I don't have any money. I mean, you might have money. What do I know?
Well,
But,
yeah, but I was working, basically, I was, like, seeing a client, transferring that money into this. I haven't made the money on TeleWellness Hub, but I did pitch. I've done pitch competitions, and I'm so fortunate that I did have investors come up, ask questions, and give me feedback too. I had recently talked to a very, very big VC, firm, but I think because I believe in the ability of us coming together, I have pivoted, I think, the messaging to be a part of this and be a part of the decision making, and I'm a colleague, and let's be in this together and make decisions about this platform and what it needs and the features. And so I now have my ideal target number so that I know when we have 1,000 providers on here, I know for a fact that we can play with the big dogs, right? Like, we can play the game
Okay.
and play it effectively, and that gives me a goal of, once I have this number and we can work towards it, like, we can really do this together. And I think, and really doing it a service to the helpers, right? Like, I'm trying to help the helpers so that they can help. That's really the goal here. So, um,
Hmm.
yeah, there was
Yeah.
yeah, I mean, the thought has crossed. I've done, financial accelerator programs, so I've been very fortunate to learn a lot, research, be informed about, potential loans. I've applied for grants, and I wanted, it might be like a control thing, but you do give up a lot of the vision and the mission when you go with ABC. And
Spot on.
yeah, I wanna be as clear and staying in the mission for this and the vision for how it can help amplify our voices as providers.
Hmm.
And so I'm going there first. That's where we're going, and we're gonna go all in.
I love it. Right? That's it.
Yeah.
One of the things when I was on, folks, the podcast I was on recently, because I'd love for you to tune in, is
Oh, yeah.
Trailblazers in Coffee. It's Dr. Abby
Ooh,
Brown and Dr.
okay.
Christina Pecora. It's real
Mhm.
talk with women leaders. They are
Love that.
badass women. I love them. I know them as friends and colleagues, and just smart stuff. But we were talking about how important it is for, especially for women, to leap. Right, and that's what you did. You went. You've been a therapist and a practice owner and a coach, and you just took this leap.
Yeah.
And you're saying it
It's
wasn't
kind of funny
just.
when you really think about it because it was a big leap, and yeah, and not a lot of women in this tech field. So it was a big jump in coming from a world of feeling and curiosity and approaching things like just
Yep.
to a very different world. And I realized I need to learn, and I need to be able to speak clearly about what I envision for this. And
Mhm.
yeah.
Yep. Right. Being, I hate the term. I don't hate it. The term buttoned up, but kind of having. You really need to be able to speak intelligently. And folks, there is something to be said for having investors. I don't have investors at this point. And to your point, perhaps it's because I like having the decision-making
Yeah.
seat, and I
Mhm.
don't really wanna give that up. I mean, I've
Mhm.
had lots of people approach and, "No, thank you," and it hasn't been necessary, but so you mentioned a couple of things. You mentioned a pitch competition. So if somebody has a big idea, and I wanna talk more about the hub, but I really would like to hear a little bit about, I
Yeah.
think it would be useful for listeners to hear, because maybe you'll be coaching them about how do they get there.
Yeah.
Um, but what is a pitch competition?
Yes. So I had never in my wildest dreams thought I would be in a pitch competition, but I found myself in one. I think when we think of a pitch, we typically think of like Shark Tank, right? You have a set amount of time to state what's the problem, how do you have a solution for the problem in the market? What are you solving? And if you received funding, what could you do, with it? So I did one through I was part of at the time I lived in El Paso. I'm in San Antonio right now, but El Paso is home, and I joined a venture mentor program, and that was really incredible. And they said, "Okay, I think you should join this competition, and you could only have 10 slides." There were 10, kind of a slide deck, a PowerPoint presentation, and you had 10 slides.
Wow,
And I
10.
yeah, and I don't remember if it was 3 minutes. It definitely was no more than 5 minutes to state everything, like who you are, who's your team, What's the problem? And I was like, well, there's a huge mental health crisis. How are we going to solve it? How is TeleWellness Hub unique? What value does it bring, and what could we do with the funding? And it was an incredible opportunity for me to speak in an audience. First of all, to really clarify my message. I spent so much time on this because you have to be really clear and succinct. And I was able to clarify my message and speak to others about what I was doing, and have people in the room. Even though I didn't get funding from it, I didn't pursue funding, there were people that gave me great input, great ideas, um, really great encouraging feedback, like, "Wow, this is something. You need to keep going," you know? That sometimes is everything, because it can be very lonely in entrepreneurship, right? If you're on your own, it could be very, like, "Is this the right thing? Is this kinda crazy?" You know, especially with such a big leap, you know, am I doing the right thing? But having that encouragement was really wonderful, and also it led to other doors opening where, there was someone, a leader in, one of the university health, UT Health, was able to give my cell phone number to the CFO of a hospital system who was looking for an internship. And all of a sudden I had, yes, a CFO of a hospital system as my intern while
Oh
they were
my
getting their
gosh,
master's in
what?
public health. Yeah. So and she was an incredible blessing and gift. And so really there's all these little moments that added up. Um, they're kind of putting yourself out there, right? And it one thing led to another. So yeah, that's what a pitch competition is. It's typically you use it for asking for funding, and there are angel investors, so people who will just invest. There's different ways to receive funding, and I actually recently emailed an investor who had given me great feedback, just with a general question of like, okay, moving forward, what do you think I should really focus on? My strategy, and they're there as incredible mentors, really. So I just, if you have a big idea, if anyone listening has a big idea, I would say it absolutely helps to take the leap and find other people who could be your mentor, who encourages that, who sees that leap and says like, "Okay, I'll help lift you up, or I'll be there as a safety net," right? Like, "Don't worry, take the leap. We'll be here along the way."
Mm,
Mhm.
I love that. That's
Mhm.
such great advice. That's it exactly. And as women in particular, and again, folks, sorry to make this gendered, but
Yeah.
I think a lot of us get the messages, don't be big, don't leap. And we have to.
We
We
have to.
have to let ourselves be big. The other thing I was thinking, Marta, I mean, you've spoken so beautifully about your desire to help clients, to help clinicians, to bring us all together. And I adore that. My favorite nexus is where we get to do that and we make some money.
Mhm.
Right.
Yeah.
So, my wish for you is that you get to do both, right? Because
Yeah.
this is a huge investment of your life capital,
Yeah.
not just your physical cap, right? But your
Right.
life capital. And so, right, part of that, and that's what entrepreneurship is by definition. There is that leap and that assumption of risk. There is going to be
Mhm.
risk involved. So,
Mhm.
right, if you don't have a stomach for that, this can be a hard path. But you've got to do it if you want to have that big dream come true. So, I want to make sure that you have some time to tell us anything you'd like our listeners to know about TeleWellness Hub so that people
Okay.
can get involved. Because, folks, this looks amazing to me. And I want to be one of those people who lifts you up and
Oh,
helps move
thanks.
you forward in my little corner of the world. So, tell us a little more about the hub and how can we get involved?
Well, TeleWellness Hub, as I mentioned, is going to have its a big reveal open house this month. So visit telewellnesshub.com and check it out. And you can join. There's a free trial similar to other directories out there, right? You join, it's a monthly membership, but you can try it out. No credit card needed, to just kind of glance in, check it out for a couple weeks, see if it's for you. I really also made it for those people who are taking a leap into private practice, because it is overwhelming to figure out, okay, I have to come up with a name, a website. I have to figure out how to code, do SEO. We're doing that for you by working collectively, right? We're able to do that. So really it's a directory that can replace the need for a landing page or like, a basic website. So that's also why I created it, because you can list your social media on there, links to any products you might be selling anywhere. Like we have had providers who have their practice and they can click on the appointment link. You can enter your own. If you have any EHR that you're using for your appointment scheduling, you can add that directly on there, so people can schedule if they like with you. They can message you, they can call you. So visit our website, telewellnesshub.com. We have multiple tiers. Something I'm doing for this launch of our custom website for this directory is I'm offering a sliding scale, but for providers, so that we have the option, especially for this, we're starting out, or maybe this is something they're doing private practice on the side and they're still learning or figuring out what to do. I've been there where I transitioned into private practice, and for me it was because the agency I was working for closed, and so was out of necessity. I thought, okay, I
Right.
guess I'm going to go to private practice.
You needed a job.
I
So,
needed a job, and so I figured out a way to just go. But I remember that feeling of like, I hope people show up. Like, I hope this works out. So this is really, I wanted to make TeleWellness Hub an opportunity for providers to thrive, whether you're in transition of transforming your work into private practice, if you're transforming outside of therapy sessions and you're offering products. What I was mentioning earlier is we've had providers that have shared just amazing work that they're doing to help clients before they even schedule an appointment. So it helps that rapport building, but passive
mm,
income for providers because they're able to share. We've had people share their digital downloads, a $20 worksheet, workbook, products that they sell on Etsy. They link that. There's merchandise, there's books on Amazon, they're sharing their YouTube videos. So there's that rapport building, but also really in one digital hub, one directory profile, really able to replace the need for a landing page, a website, linking their social media. I mean, I've been so fortunate to have an incredible team that has been able to make this happen because I started out trying to do it through like a WordPress site, and I found that
oh, oh,
we just
ouch.
couldn't. Yeah, we couldn't. We could.
Do respect WordPress, but
Yes,
ouch. Just
yes,
saying.
yes, yes. And there were,
Yeah.
recently in the news there were things with about plugins and issues, and so I've learned a lot about to keep up to date with the tech news because it greatly impacts what we're doing. But visit telewellnesshub.com. I welcome everybody to message me. I have links to where they can contact me if you have questions, suggestions. I genuinely want to hear any and all feedback on how we can help TeleWellness Hub be the platform that helps you thrive. I mean, that's really the goal, to be able to see more clients if that's what you're wanting to do, or to also share impact and build rapport and have a landing place for our clients between sessions if you have other things that you're offering. Yes.
Mhm. Hmm.
Mm-hmm.
This is brilliant, Marta, and I love that. That could be a great tagline, what you just said a moment ago about, "This is a place to help you thrive." And that's true, whether you're a client, whether you're a provider. I mean, I can hear that is your desire. That's your passion. That's why you're doing this. And so, folks, please go to telewellnesshub.com, take a look at it, see what you think.
Yes.
Sign up. You said there's a free version. I'm assuming there might be a tiered system at some point.
Yes, it's free for 14 days, no credit card. Check it out. It's $29 a month, so competitively
Not
priced.
bad, not
No,
bad.
for all of that. And if you'd like to
Mhm.
do one where we do a little bit more media content for you, a podcast episode, a YouTube video, and we do the SEO, there's a $59 a month. But yes, check it out.
Not bad.
Mhm.
I mean, when you think about a marketing budget or doing Google Ads or
Yes.
so many other things, $59 a month, and easy for me to say. I know not everybody has $59 a month, but to move the needle forward it really does take capital.
It
So
does.
I think
Yes.
it sounds like it's fairly and reasonably priced. So count me in. I'm
Thank
gonna
you.
get myself a subscription here
Yes, that'd be
for us in our
great.
practice. And you know what? We're here in the Chicago area, so please send things to me. I will shoot them out to my network.
Oh, that would be
I would be happy to
wonderful.
do that because we have
Yes,
to support each other, right? And
we do.
so I
Yes.
would be thrilled to do that. Well, Marta Hamilton, any final thoughts for our listeners?
I guess, if I had any final thoughts, not related to TeleWellness Hub, but just as colleagues, I love that you are amplifying the voices and the dreams, and especially for freedom. So I think, yeah, freedom in business. I think that's huge. And so my final thought would be, I know right now there's a lot of questions in our field of like, what direction are we going in? And I think the value of each provider is so huge. I genuinely have enjoyed connecting with every provider that I've met along the way with TeleWellness Hub. And I really encourage everybody to pursue their individual, unique strengths and gifts and interests because it just makes the world a better place. So, yeah.
Absolutely.
Mhm.
That's fabulous. It makes the world a better place, which is our mission. I think all of us as
Yeah.
healers. So
Yeah.
I'm looking forward to this. I'm looking forward to helping move this forward because
Oh,
I'm
thank you.
excited about this. It just
Yes.
sounds delightful. You're delightful, folks. Please check out Marta Hamilton. Check out TeleWellness Hub. Do the free version. If you can pay
Mhm.
for it, pay for it. It moves us all forward. So, Marta, thank you so much. Listeners out there, thank you so much for joining us today and always. And I'm Margo Jacquot, your mental health business mentor. We will look forward to having you here with us next time. Be well.